Good afternoon. My name is Ron Velacity. I'm the Chief Operating Officer for Family Guidance Centers. On behalf of our Board of Directors, our President, Dr. Larry Kroll, our staff, and all the patients we serve, welcome to Family Guidance Centers and to this historic event. We are very honored to have in our presence today what I believe is the strongest supporter of behavioral health care services in Illinois, Governor Jb Pritzker. We are also honored to have Lieutenant Governor, distinguished members of the Illinois General Assembly, Cook County Commissioners, representatives of the Governor's administration, specifically from the Illinois Department of Human Services, along with our Behavioral Health Care Association partners and other partners. Family Guidance Centers is a community-based substance use and mental health disorder treatment provider. We've been in existence for over 50 years. During this time, we have provided quality behavioral health care in Illinois. We currently have 14 locations throughout the state. We are serving 5,000 patients a day. I wanted to take a moment and share our thanks and appreciation to the Governor, to the Illinois General Assembly, to all our other legislators and government representatives, to the staff of DHS and Super, for all you have done individually and collectively to support the existence and now the expansion of behavioral health care services in Illinois. As a community provider, I now know we have a true partnership with government that has grown amidst a traumatic opioid epidemic and the coronavirus pandemic that we are still experiencing today. By allowing community providers an opportunity to develop state-of-the-art and creative approaches to respond to substance use and mental health disorders, we can be proud that the system of care we are now offering in Illinois is starting to positively address the issues of social disparities and allowing for a system of care that allows all residents immediate access to care. By allowing for simple things like reimbursement rate increases, telehealth and telemedicine services, mobile crisis teams, mobile treatment units, and most importantly, the administration recognizing that individuals with lived experiences are a critical piece to the development of a strong person-centered recovery care system. Finally, thank you all for your recognition that like us, like every other industry, is challenged by workforce availability issues. And by making opportunities available to allow for the expansion of behavioral health care services in Illinois. The end result is that for all this support, service providers are now able to reach more people in need in a more timely and effective manner. Again, thank you all for your support. It is now truly my honor to introduce someone who has absolutely delivered on all his promises to support behavioral health care in Illinois, and it's evidenced today by a signing of this bill. Without further ado, Governor Jb Pritzker.
Thank you. Appreciate you. Well, thank you so much, Ron. Thank you for your leadership. Thanks for the kind introduction. Thank you for hosting us here at the Wabash facility of the Family Guidance Centers. For over 50 years, Family Guidance Centers have been a pioneer in holistic, compassionate mental health care services throughout the state of Illinois. And I cannot think of a better place to mark this advancement than among the exceptional company of these state leaders, legislative partners, mental health providers, and patient advocates. As governor, as a father, and as a person who grew up in a household impacted by addiction, mental health care has been an issue that is important to me personally. I've always said that we need to pull mental health out of the shadows of stigma in order to truly advance holistic health care. And it didn't take a pandemic to show us the extent of our mental health crisis, but it's clearer than ever. Everyone knows someone who's hurting. Even before COVID, our youth were facing skyrocketing levels of anxiety and depression. Meanwhile, the opioid epidemic has taken an enormous toll on the nation, while access to life-saving treatments like naloxone remained limited. Meanwhile, we've never had the number of mental health professionals to meet the demand that our communities require. And the healthcare worker shortage is more significant than ever right now. Today, I am proud to sign this mental health omnibus bill into law, training, expanding, and diversifying our behavioral health workforce. This is another big step toward an Illinois where mental and physical health care are truly accessible for all our communities. We need a mental health care workforce that is robust enough to get people help when they need it, not after months on a waiting list. By investing in behavioral health workers in training, we ensure that Illinoisans get the quality, comprehensive mental health care that they deserve, while diversifying our field of practitioners to be more representative of the communities they serve. With grants from the DHS Division of Mental Health, our future mental health care professionals will get the education and supervision they require to best support our residents. We have excellent mental health care professionals throughout our state who are currently not practicing due to bureaucratic or financial hurdles in the relicensing process. We must tap into this valuable resource to meet the demands of this current time. So this law restores licenses that have been inactive or expired for 5 years or less, so we can address our healthcare shortage head-on with experienced, qualified professionals. Substance use disorders and other mental health diagnoses should not prevent Illinoisans from the dignity of making a living. In fact, research has shown that employment can help those in recovery. That's why the Recovery and Mental Health Tax Credit Act will provide tax credits to employers who hire and provide a supportive environment for employees in recovery from substance use disorders and other mental illnesses. If we want this initiative to have tangible impacts for all Illinoisans, our approach must be evidence-based and equity-driven. So we are initiating an advisory board made up of recipients, service providers, community advocates, and academics to advise DHS on mental illness and substance use disorders impacts with a focus on employment opportunities within minority communities. This omnibus bill invests in mental health infrastructure, and that infrastructure is people. Our therapists, our social workers, our crisis counselors. There's nothing more important than investing in the people who support the health and well-being of our Illinoisans. It's why HFS will be deploying $140 million to direct service providers, and it's why we appointed a state Chief Behavioral Health Officer, David T. Jones, as well as a director of the Children's Behavioral Health Transformation Initiative, Dana Weiner. It's why we expanded telehealth to all Medicaid and private insurance consumers to include behavioral health care at the same rate as in-office care. And it's why this year's state budget includes a historic investment in mental health and substance abuse prevention and treatment services in every region of Illinois. We're in the process of stepping up the mental health care infrastructure of our state, designing systems that best support Illinoisans, especially our most vulnerable residents. And this bill builds off of that work, but it is by no means work that is finished. We will continue to transform our mental health care systems so that no person in our state goes without the support that they need to lead happy, healthy, and fulfilling lives. To our legislative partners, Senator Fine, Senator Villa, Senator Lofgren-Capel, Representative Robinson, and Representative Conroy, today's signing is the fruit of your labor. Department of Human Services DMH Director Dr. David Albert and Cook County Commissioner Dennis Deere are here today. So too is Alderman Pat Dowell, and I am very proud to stand alongside them as we transform our state's mental health infrastructure to best serve our people. Our community partners have been integral in reconceptualizing mental health care systems while consistently advocating for Illinoisans who experience behavioral health issues. Judd delos from the Illinois Association for Behavioral Health, who's here, thank you. Thank you for joining us today as we mark this notable achievement. With that, it is truly my pleasure to introduce my partner in governance, the best lieutenant governor this state has ever had, Juliana Stratton.
Hello, everyone. I'm Lieutenant Governor Juliana Stratton, and I use she, her pronouns. Thank you, Governor, for that warm introduction and for your leadership in ensuring every Illinoisan can be safe, healthy, and well. I also want to thank my friends and former colleagues in the General Assembly, including Chief Bill sponsors Senator Laura Fine and State Representative Deb Conroy, for their work to create a more qualified, competent, and diverse community behavioral health workforce. And to all of the elected officials, stakeholders, and advocates joining us today, thank you for your vision and the work to realize that vision. Today we are here to talk about mental health, to talk about being seen, heard, and helped. And if no one has ever told you before, let me just say this. It is okay to not be okay. You see, mental health challenges can impact anyone, regardless of race, gender, age, where they live, or how much money they have. And we know everyone should have access to the resources and support needed to be well. But how do we do that? Well, by standing together, supporting one another, and caring for one another, by breaking down the barriers that prevent people from receiving the help they need to heal right here in Illinois. This will show our country better ways to care because, let's be clear, this is a national problem. According to the National Institute on Mental Health, an estimated 52.9 million adults over 18 years old has a mental illness. That's 1 in 4 adults. And less than half of those adults, around 46%, receive any kind of mental health treatment or services. For Black, Hispanic, and AAPI communities, that number is even lower. Even before the COVID-19 pandemic greatly disrupted our lives and caused a spike in the need for mental and emotional support across the nation, BIPOC communities and people in our rural areas faced greater disparities in accessing mental health care. Really, far too many of our friends, neighbors, peers, and loved ones have had to suffer in silence. With the signing of Senate Bill 3617, we are making it clear that we see them, we hear them, and we are committed to doing the work that will ensure their voices, their calls for help are answered. With this bill, Illinois is not only increasing the workforce in the mental and behavioral health field, but expanding pathways for diverse, passionate, and qualified individuals to make a difference in their communities, especially in rural areas and regions that have been historically underserved and under-resourced. We recognize that mental wellness is about more than just the biological processes in the brain. It's also about the world around us and our ability to navigate it safely and successfully. So when an individual with mental illness or a substance use disorder has the economic opportunities to start a career, to afford continuing their treatment, or to be in a workplace where they don't have to worry about being discriminated against due to their condition, the road to mental health and wellness is far more feasible. That's why Senate Bill 3617 also encourages eligible employees to hire those in employers to hire those in recovery by creating a tax credit program. And these measures build on our administration's continued efforts to expand equitable access to mental health services and treatment across Illinois for children, adults, and all families and communities. As one state, we have gone through unprecedented amounts of trauma, pain, and grief these past few years. And together, we can build the groundwork that will uplift all to move forward, to create a mental health care system that is bigger and stronger than it has ever been. Thank you. And now I will pass it over to someone who is incredibly passionate about this work, who we are so grateful to have leading the Illinois Department of Human Services Division of Mental Health, Dr. David Albert.
Thank you very much, Lieutenant Governor, and thank you, Governor. And thank you, Ron, and the staff here at the Family Guidance Center for hosting us today. It is an honor to join you for the signing of the Mental Health Omnibus Bill and to share the impact we at the Illinois Department of Human Services expect this law to have on thousands of individuals we serve through the Division of Mental Health. Like the rest of the country, Illinois faces a critical shortage in the behavioral health workforce. When inadequate staff exist to serve people in behavioral health crises, pain and trauma are perpetuated, and less healing and recovery occurs. Today, we are witnessing action to alleviate the pain of mental health and substance use disorders faced by so many. In 2018, the Behavioral Health Workforce Education Center Task Force projected that by 2030, Illinois would have a shortfall of more than 3,300 behavioral health treatment providers. To address this challenge, the state is taking a multifaceted approach to improving the supply of behavioral health professionals. IDHS's Division of Mental Health is partnering with the Illinois Board of Higher Education to develop a behavioral health workforce education center at SIU and UIC. We are excited about the work that the center will do in the coming years to expand the behavioral health workforce in our state. The Mental Health Omnibus Bill gives Illinois several vital new tools. It will enable IDHS to grant awards to enhance supervision of providers in training in more than 200 community mental health centers across Illinois. It will also foster increased diversity so that the behavioral health workforce better reflects the population of our state. We know that employment is an essential part of recovery. Individuals in recovery want to work, but finding employment can be a challenge. Employment brings income, self-esteem, opportunities for socialization, and a better quality of life. Study after study has demonstrated that working leads to better control of symptoms of mental illnesses and a reduction in substance use. Since 2005, IDHS has been supporting individuals with serious mental illnesses in our state through Individualized Placement and Support, IPS, a program offered at community mental health centers across Illinois. In fact, Illinois is considered a leader in this area, and our service providers work daily with thousands of individuals who are seeking competitive employment opportunities in jobs that interest them. Today's establishment of a recovery and mental health tax credit offers a strong incentive for employers to hire individuals with mental health and substance use histories, which will further increase employment opportunities for people who often desperately want and need a chance to work. As the director of the Mental Health Division at IDHS, I'm grateful to the Illinois legislators and to our governor for passing the Mental Health Omnibus Bill. Illinois will be better for it. Thank you. And it is now my pleasure to introduce Judd delos, CEO of the Illinois Association of Behavioral Health.
Good afternoon, everyone. My name is Judd delos. I am the CEO of IABH, or the Illinois Association for Behavioral Health, which is a trade association representing behavioral health care providers, meaning mental health or addiction or substance use disorder providers across the state of Illinois. Very proud to be standing here with the governor, lieutenant governor, and these behavioral health champions alongside IABH member family guidance centers for today's signing. In particular, we are proud at IABH of the unique aspect, and Director Albert mentioned it, the Recovery and Mental Health Tax Credit Act. That particular portion of the bill provides for a tax credit or tax savings to employers that hire those in recovery from mental illness or addiction. Put simply, the employee on a voluntary basis may disclose to their employer or prospective employer that they are in recovery from that mental illness or addiction, and then that employer may file, using appropriate documentation, for a tax credit of up to $2,000 per employee per year. And we think this particular piece of unique legislation will not only provide tax savings to all employers in Illinois, not just the behavioral health space, but all employers, but it will also help reduce stigma associated with those that are subject to mental illness or addiction diseases. So at this point, I would like to, again, thank everyone that supported this, particularly the governor, Senator Laura Fine, Representative Conroy, the Department of Human Services, the Department of Revenue, who will be issuing the tax relief, and appreciate the opportunity to be here today. With that, I would like to turn it over to Senator Laura Fine. Thank you.
Good afternoon, everyone. My name is Laura Fine. I am the proud chair of the Senate Mental and Behavioral Health Committee. I'm also very proud to live in a state that cares about the well-being of its residents and is working to ensure that mental health is treated the same as physical health. Everyone is impacted by mental health, if it's their own struggles, that of their friends, or that of their family members. And this has only been exacerbated by the pandemic. My colleague, Representative Deb Conroy, began a mental health and addiction committee in the House a number of years ago. Then I was fortunate to chair a new mental and behavioral health committee in the Senate. Because of this partnership, the legislature is making mental health a priority. We've made many strides, but we still have a long way to go. Today is a giant step towards ensuring Illinois residents get the quality, affordable care they need and they deserve. This new law is over a year in the making, and accumulation of hard work and dedication of partners and advocates from every corner of our state. It began with hearings discussing the challenges we face, and then it found solutions to those challenges. One of the biggest roadblocks to patients is a lack of providers. Right now, there are only 14 behavioral health care professionals for every 10,000 Illinois residents. This creates an incredible obstacle for people bravely taking the first steps to seek mental health and substance use disorder treatment. They are challenged finding a provider who has the time to see them, a provider they can afford, or a provider that is the best fit for them. And as we all know, a mental health emergency cannot wait. It is very frustrating to hear that patients who are seeking inpatient treatment are denied care despite having empty beds only because there's simply not enough providers available to offer them the quality and experienced care that they deserved. This law works to change that. This bill accelerates the process for out-of-state clinicians applying for licensure in Illinois, as well as cutting the red tape for social workers, professional counselors, and clinical psychologists with licenses that have been inactive for up to 5 years. As we've already heard, it also includes incentives to support diversity in the mental health field. It establishes tax credits for employees who hire people in recovery, and there are so many other important pieces that is going to result in more quality, accessible care to those who are seeking assistance. This new law is known as the Ensuring a More Qualified, Competent, and Diverse Community Behavioral Health Workforce Act, and it assures that in Illinois, mental health is a priority, and the legislature is working hard to improve access to this essential treatment so everyone can live their best life. Thank you again, and with that, I would like to turn it over to my colleague in the House, Representative Robinson.
Thank you, Senator. My name is Lamont Robinson. I represent the 5th District in the Illinois General Assembly, which is where we are this afternoon. Ron, I would like to thank you and your team for over 50 years of service to our community. As a kid and even as an adult, I was ashamed to tell my story. I want to thank the governor for sharing his story. I want to thank the governor for putting mental health as a priority in our state. Governor, like your mother, my father also struggled. When he was sober, he was great. He was brilliant. He stood for progressive values that he also taught me. He was also a fighter. Like your mother and my father, Governor, it is why today we can keep fighting this mental health fight for our state and address the mental health issues that are plaguing our constituents all across the great state of Illinois without shame and/or stigma. The bill that's being signed today helps make those invisible illnesses visible by providing people dealing with mental illness and substance abuse with the resources they need to live their full lives. Alderman Dowell, who is with us today, who is the budget chair of the City of Chicago, and I discuss on many occasions how to combat the violence that's plaguing our city and our state. And this bill helps with ending that violence that we're seeing every single day in the city of Chicago. These tools and resources are an integral step in supporting those with mental illness. But we cannot stop here. I'm looking forward to working with my fellow lawmakers to make sure everyone, regardless of circumstance, background, and/or ability, have the tools they need to live happy and healthy lives. I would like to bring up Dr. Dennis Deere, who is not only a Cook County Commissioner, but a champion for mental health. Thank you.
Good afternoon. Look, I always start by saying God is good and all the time. It is a delight to be here with each of you today. I'm thankful for our governor, our lieutenant governor, our aldermen, our state reps and senators that are here today. But I'm thankful to be here today. Cook County Commissioner, 2nd District, welcome to the 2nd County District. I'm also chair of Health and Hospitals for Cook County. I approach this from two vantage points. I'm a county commissioner and legislator, but I'm also a psychologist. I'm also a kid that grew up on the west side of Chicago who witnessed his first murder at 10 years old. Do you think that had an impact on me? It was gun violence, but it was also PTSD for me. I walked around with PTSD for 12 years and didn't know it. The only reason I went to counseling is when I got on the campus of Jackson State University and told them I wanted to be a clinician. They told me I could not be a clinician without going through counseling myself. And I said to them, well, they told us if you go to counseling, that means you crazy. And they say they told you wrong. You probably not so bright if you don't go to counseling. So I'm here to tell you, this bill excites me. We are at Cook County. I declared mental health and a lack of services a public health crisis. We put $60 million into our budget to deal with mental health. And we'll open up the first mental health center, or mental health office in Cook County. This bill helps us. We can partner with our partners at the state level and at the city level to deal with this. This doesn't happen overnight. Even today, as a county commissioner, imagine how many phone calls I get with people who want me to be their therapist. Now, I thought you were calling for some issues with the district. No, we heard about you and you black, and we can't find another black therapist. Imagine that. This bill helps us out with that. Diversifying the workforce. This has to be some for us, by us stuff. We need more Latino, clinicians, more Asian American clinicians, more black clinicians. We need clinicians that's diverse, that's as diverse as the state of Illinois. This bill helps us for that. The last thing that I will say is it is important that we do a campaign of education. A campaign of education, because today mental health and behavioral health is taboo. I was appointed to the National Institute of Drug Abuse, which is one of the National Institutes of Health. And the thing that I resound with the most is a campaign of education and making sure that minorities and disparities are dealt with. We have to do that campaign of education between the state, city, county, and feds. I'll leave with this. It's not justice, it's just us, and it is up to us.
Now I'm going to sign the bill, which is the most important, exciting thing we get to do today. So I hope you'll join me. Step out of the way here a little bit. Get some pictures. Go ahead, you get in there. Great. Now I'm going to take a few questions from members of the media, and I see Mary Ann.
Thank you, Governor, and I apologize to those who I know this is a very important issue, but because of limited time, I do have a political question for you about the campaign. And with the new polling that shows that Darren Bailey now ahead, Mayor Urban today says a vote for Darren Bailey is a vote for you. Would you respond to that, as well as the amount of money spent by you in this Republican primary that's unprecedented?
Well, it's a ridiculous statement, the idea of equating the most conservative person on the Republican side with me. I'm a Democrat. I believe in the values of the Democratic Party. He's a right-wing conservative. He's anti-choice. I'm pro-choice. He's pro-Trump. I clearly have not been an ally of former President Trump. And so there's just no equating the two.
Would you rather face a Darren Bailey than a Richard Urban?
I'll face anybody on the other side of the aisle. And we'll win.
Could I ask you as well, there's an investigation that's open on Dr. Ezike because she took a job before the one-year period, and she is now involved in perhaps contracts with the state of Illinois. Where do you stand on that investigation?
Well, let me begin by saying Dr. Ezike has been a phenomenal public servant. She truly saved lives. You all, I think, understand that. She's been a leader who has helped Illinois become a leader at vaccinating people, at making sure that we had testing available, keeping people healthy. That story that you're referring to about her indicates that there's a debate about this provision that they're looking at. And all I can tell you is that Dr. Ezike left the Department of Public Health not to take some big-time job at a major corporation, pharmaceutical or otherwise. She went to a safety net hospital, doing yet again more public service. So I want you to know I believe now, as I have throughout her tenure, that she's one of the great public servants that we've had in Illinois. I'm proud of her, and I know they'll get through this, look at all of whatever is necessary, but I want to be clear, she's somebody who is always trying to do the right thing.
So perhaps 1 year is too long as far as staying away from taking jobs?
Oh, I don't know. Again, the law was written and passed before I became governor, and the provisions of it don't apply to me specifically, but there's some legal wrangling, at least, again, as you read that article, you can see it. So I don't know what's too long or not long enough, but I know on her part, I know her heart, and she would not intentionally do anything to abrogate or breach anything that was wrong. And it looked like she consulted with a number of attorneys along the way.
Governor, it was mentioned several times today, there's a workforce shortage, especially when it comes to healthcare and mental health. And while this now law does address a lot of those things, does it do enough to attract new mental health professionals coming through schools and attracting more people to the industry?
This bill alone doesn't do enough, but remember, we've also done quite a number of other things. For example, provide scholarships for people who want to go become nurses or become other types of healthcare workers, because we all recognize there is a shortage of healthcare workers. And that industry is growing. It's not just because of the pandemic. The industry was growing before. There was a shortage before the pandemic. So we're doing everything that we can imagine, and I look at my colleagues in the General Assembly. I mean, they really have worked hard to look at each way in which we can make it easier. You saw during the pandemic, for example, that something similar to this, we said, hey, nurses that have retired or other healthcare workers that have retired, we need them back in the profession as soon as humanly possible. If they're willing to come back, let's not make them go through the entire licensing process again that they've already been through, and they've just decided at some point that they wanted to retire, but now they're willing to step back in. So we made that easier for them to come in. We helped schools that are graduating nurses to do that faster, making sure they're all qualified to do it, but making sure they can get through the process of getting licensed faster as they graduate. So those are examples. There is much more to do. I don't want to suggest this is the only thing that has been done or that we will do. Thank you. Thank you.